Hello and welcome to the 5th recording of the Pain Management Handbook. As with every other recording, we'll start off by having a think about the previous recording and what you thought about it. So maybe just take some time to have a think about what you learned or what seemed useful. You might also pause the recording to think about what you're going to do differently after the things we've looked at. The first topic in this session is positive psychology. We know that pain affects a lot more than what is going on in your body. It's normal for people to feel upset, down, anxious and depressed when their pain continues, although it's understandable that people might think that if we get rid of the pain, everything else in their lives will fall into place. Research and experience tells us that this isn't how persistent pain works. In order to manage persistent pain, we need to be able to get ourselves in the right place psychologically as well as physically. In this section, we're going to look at a relatively new approach to well-being called positive psychology. Until recently, most approaches to psychology and therapy have been about fixing something that is wrong or broken. Research is now focusing on building and maintaining things that can encourage happiness rather than aiming at not miserable. There is evidence that shows that we can learn to cultivate happiness no matter where we live, what has happened to us, how much money we have, or what physical conditions we may have. Taking steps to building a bigger sense of well-being and happiness will boost our chances of developing a good relationship with our pain condition and the world around us. It will also reduce the chances of developing issues with mental health such as depression and anxiety, which often come together with pain conditions and can have a debilitating effect on our lives. Positive psychology focuses on our growth as a person. It does this rather than focusing on illness or what is wrong. Positive psychology can free people from their belief that they must be a certain way if they have a physical, psychological, or social problem. It helps people to act and lead meaningful and fulfilling lives in line with their own values and beliefs. Positive psychology often works by improving relationships with family, friends, and the wider group that people have contact with. It improves well-being, resilience, and hope while living a life full of both adversity and joy. The research on this shows that there are many things a person can do to start cultivating happiness. Not a single one of those involves winning the lottery. Although what makes each of us happy will vary, if we can do something that falls into each of the 10 general categories we're about to go through, then the chances are that we can improve our happiness and well-being. So the next page looks at an acronym, the 10 keys to happier living. The acronym is Great Dream. So we'll have a look at what each of the letters of Great Dream mean and how you can take advantage of them. The G stands for giving. The suggestions under giving is that people try to do things for others, volunteer, engage in random acts of kindness, make something happen for a good cause, or maybe helping out a friend in need. Relating is the R, and it suggests that we connect with people, that we really listen to what people are saying, that we increase contact with other people, that we cultivate a close personal relationship, that we enhance our relationships with those around us and our partners, that we ask others about the things that have gone well. Maybe picking up the phone or paying someone a visit, making eye contact, smiling, getting to know our neighbours better, and thinking about who matters most to us. The E in Great Dream stands for exercising, taking care of our bodies, becoming more active, making sure we get enough sleep, go outside, watch less TV, reduce our screen time, stretch, breathe, and find a way to make exercise fun. The A in the great part of Great Dream stands for awareness. Live life mindfully. Stop and take notice, it's suggested. Take care of the world around you. Increase contact with nature. Be curious and get inspired. And savour the pleasant. The T in Great Dream stands for trying out. It suggests to do something you've never done before. Talk to a new person. Learn something new. Go back into education. Go to the library. Use the internet for something useful. We move on to the dream component of Great Dream. The D stands for direction. Have goals to work towards. Have a dream. Set achievable goals. Know what your values are. Set a goal and make it happen. The second R in this acronym stands for resilience. Learn to bounce back when times get hard. Know how to look after yourself when you feel bad. Ask for help when you're struggling. Talk to your GP about your mental health. Try to show kindness and compassion towards yourself. Teach emotional resilience to your children. The second E stands for emotion. Make time for fun. Count your blessings, maybe 3 good things at a time. Look for the good in yourself and others. Detect and reduce cognitive distortions or thinking errors. Say thank you to somebody important to you and write it down. The next A stands for acceptance. Learn what is under your control. Forgive yourself and others. Stop comparing yourself and let go of baggage. And finally, the M stands for meaning. Increase experience of positive emotions. Use of flow. Religion. Learn to meditate. Simplify your desires and cultivate mindfulness. Discuss with someone which areas you are most interested in. See how they fit with your values. Set a goal to work towards what you feel will make you happier. Next, we move on to sleep. Around 80% of people with chronic pain have problems with their sleep. We cannot guarantee an improvement in sleep, however. Many people benefit from the following approaches to improve their sleep. It is worth understanding how sleep works. This can help you to understand how the approaches are helpful. Sleep is not just a state of being knocked out or unconscious. There are many things that happen when we sleep. If these do not occur, then we will wake up feeling unrefreshed and in a poor mood. Over time, we may even develop health problems. Sleep goes through cycles. The diagram on this page shows this, and I will discuss it in a moment. Not all sleep is the same. We sleep deeper in the first part of the night. We dream more in the later part of the night. To have a good sleep, we need to have both deep sleep and this dream or rapid eye movement sleep. If we are unable to get the deep sleep, then our body cannot repair itself properly and we feel mentally tired. If we cannot get the REM sleep or REM sleep, then it is possible that our memory can become affected. So there is a diagram at the bottom of the page which shows various stages of sleep, 5 in total. So we start off awake, which is described as having alpha patterning, and we then move down into stage 1 to transition into sleep, stage 2 of light sleep, stage 3 of mental relaxation, stage 4 of body repair, slow wave and delta sleep. And finally, moving back up to REM sleep. In the diagram, we go through these cycles 3 or 4 times, but as we go through each cycle, we go into less of the deep sleep, staying more in the lighter sleep. Some conditions, such as fibromyalgia, create odd sleep patterns, with people not always getting the good slow wave sleep. Instead, they get a combination of this and waking brain activity. This poor sleep may cause some of the symptoms of fibromyalgia. Each sleep cycle can last 90 minutes, but they can be as short as 70 minutes or as long as 120 minutes. If you miss the first 10 minutes of the sleep cycle, then you may not get back to sleep until a new sleep cycle starts. This can take over an hour. It explains why people can wake up at night and lie awake for a long time. If this is the case for you, consider getting up. Lying in bed generally frustrates, making sleep less likely. To help people get to sleep, there are a number of things that can be tried. Some of these involve changing your surroundings. Some are things you can try to change yourself, mentally and physically. Advice for good sleep. Note, it is important to discuss poor sleep with your GP in case you have a medical condition such as sleep apnea. If sleep is disturbed in the short term, this is okay. Unfortunately, many long sleep problems are due to bad habits. We pick up these bad habits when our sleep is disturbed for a long time. When tired, we may nap in the daytime. However, this can affect the quality of our nighttime sleep cycles. Try to keep daytime naps to less than a half an hour. Caffeine, alcohol, and medication can seriously affect our sleep. Some people take medication or alcohol to help them sleep. Whilst these may help them to drop off, it changes their sleep cycles. Over time, they can feel unrefreshed. Avoid alcohol prior to going to bed. Consider speaking to your GP about changing your medication to avoid unrefreshing sleep. Try not to have caffeine after early afternoon. This can be tricky as some medications contain caffeine. Both tea and chocolate contain caffeine, in addition to coffee, of course. It may be wise to avoid energy drinks, and these have a number of stimulants in them. Smoking is also a stimulant. Avoid smoking before bed. Consider reducing your nicotine intake over time. Craving for nicotine can wake you up, so reducing the need for this will be helpful. Changing your surroundings can help you sleep. Make sure that your bedroom is dark. Fresh air is helpful. A bedroom that is cool can also be helpful. Clock watching causes stress. Consider removing the clock or turn it around so you cannot see it. Waking up and worrying about the time will increase your body's adrenaline. This will wake you up further. Consider getting up if you are awake and have not been able to get to sleep for a while. This reduces the association of your bed being an unpleasant or frustrating place. Do not do anything too stimulating when up, as this will make it less likely you can get back to sleep later. Get a regular routine. Go to bed at the same time every night. Make sure that you sleep in the bedroom. Remove the TV or radio and make sure that the bedroom is used only for sleep or sex. Having an office or TV in your bedroom can mean that your mind will associate the bedroom with being awake. Try to avoid this. Relaxation and mindfulness. Preparing yourself for sleep. Try not watching TV, reading, or using your computer, tablet, or phone for at least an hour before going to bed. Try this for a number of days. This will mean that your brain activity will not be overstimulated. People find when they try this that they get more restful sleep. Practice relaxation, meditation, and even gentle stretches before going to bed. Do not wait till bed time to discuss or worry about important things. Make time to sort these out earlier in the evening when you are more awake. Do not eat prior to going to bed. Don't plan to stay in bed for too long. This is especially important for people who suffer from fatigue. It is possible to end up having many hours of shallow sleep, but no deep sleep. Thoughts. Try to be happy with the amount of sleep you're getting. For some people, 5 hours sleep is normal. Try not to catch up on your sleep. The evidence is that you can only catch up on a small amount of missed sleep. Look at your sleep history. Have you had to stay awake for a reason in the past? For example, looking after someone or shift work. Spend time thinking about whether this has changed. It is important to feel that the reason for staying awake has now gone. Consider suggesting to yourself that you can allow yourself to sleep more deeply just before dropping off to sleep. Here are some tips for working with a busy mind. Set a to-do list system that you trust. It has to be a system that you know will work. If a job goes on the list, it gets done. It is important that you have complete confidence in this. Otherwise, you will continue to worry about something not getting done, even though you've put it on the list. Keep the list short, otherwise it will become ineffective as a to-do list. Consider planning specific times for some tasks. Build in thinking time into your day, otherwise you will start thinking at the first bit of quiet time you have. Often this is when you are lying in bed. Consider keeping a reflection diary so that your thoughts can progress and you don't have to keep going over the same old thoughts. Interrupt mental busyness by getting up and doing something physical. Remind yourself, if you're worrying about something, that it is already on the to-do list or in your reflection diary and that you do not need to rethink about it now. Practice tuning into enjoyable body sensations, such as the breath. Practice just sitting or letting go of thoughts. Practice boredom. Remember, worry can be addictive and habitual in nature. You can't fix worrying by doing more worrying. Use the techniques above to help let go of this habit. Next, we look at medication for managing pain. First, we have a list asking, how helpful is medication for pain? Pain medication is a commonly used approach to helping manage pain. Pain medication will very rarely resolve pain on its own. There is no such thing as a painkiller. Pain medication may be useful as part of a broader pain management plan. Our understanding of the usefulness of medication and the potential for problems is evolving and changing. We now recognise that many pain medications are not as useful as we previously thought. We're going to have a look at the different types of pain medication. These are categorised here into paracetamol, non-steroidal anti-inflammatory medications, opioids, medication for neuropathic or nerve pain, and a collection of others. There is a diagram showing as to where the different medications seem to work. There is an arrow leading from paracetamol to parts of our brain, which are labelled as the amygdala, cortical sites, and the thalamus. Opioids, such as codeine or morphine, have a line going to these parts of the brain also, but also to a diagram of a section of the spinal cord. Non-steroidal anti-inflammatory drugs have a label going only to the spinal cord. Paracetamol, probably the world's most used medication. It's classed as an anti-inflammatory, but the action is not fully understood. It can reduce a high temperature, generally well absorbed and tolerated, but it can cause liver damage in overdose, which means no more than 8 tablets a day. There is not much difference between different makes of paracetamol. The next type of medication are non-steroidal anti-inflammatory drugs. They work by reducing inflammation and are aspirin-like drugs. only therefore helpful when there is inflammation. They have 3 effects in reducing inflammation. They reduce pain, and they may reduce temperature too. Wide range available such as ibuprofen, diclofenac, indomethacin, or celecoxib, amongst others. The main side effects are gastric irritation, that they affect the kidneys too. They may exacerbate or make asthma worse. They inhibit platelet function and increase the likelihood of thrombotic events. So this is blood clots. It's important not to take more than is prescribed of non-steroidal anti-inflammatory drugs. The advice is to take in low doses and for short periods of time as much as possible. They're also available in topical rubs, which can be helpful and avoid some of the side effects. Next, we look at opioids. These work by mimicking natural pain-reducing hormones in the body, endorphins, dynorphins, and enkephalins. They affect pain signals in the spinal cord and the brain, and they have a wide range of effects throughout all body systems. The side effects of opioids. The initial side effects include feeling dizzy, feeling sick, or being sick, feeling sleepy, or feeling confused. Longer-term side effects include constipation, itching, weight gain, a reduced sex drive, difficulty breathing at night, reduced fertility, and irregular periods. Because opioids can stop the production of the natural pain hormones, they can cause problems of dependence. This will cause symptoms if you suddenly stop taking an opioid. Tolerance. The medication becomes less effective the longer you take them and can cause addiction. You may become addicted to opioid medications. There is a message from the Opioid Aware campaign from the Royal College of Anaesthetists. It is laid out in bullet points. The first one says, opioids are very good analgesics for acute pain and for pain at the end of life, but there is little evidence that they are helpful for long-term pain. Point 2 says a small proportion of people may obtain good pain relief with opioids in the long term if the dose can be kept low and especially if their use is intermittent. However, it is difficult to identify these people at the point of opioid initiation. Point 3 says the risk of harm increases substantially at doses above an oral morphine equivalent of 120 mg per day, but there is no increased benefit beyond this point. If a patient is using opioids but is still in pain, the opioids are not effective and should be discontinued, even if no other treatment is available. Point 5 says that chronic pain is very complex, and if patients have refractory and disabling symptoms, particularly if they're on very high doses, a very detailed assessment of the many emotional influences on their pain experiences is essential. And there is a list of other medications, which include gabapentinoids, which is gabapentin and pregabalin, antidepressants of amitriptyline and duloxetine, and capsaicin. There is a summary section, and in summary it says, medication can be useful as part of a broader pain management program. All pain medication has side effects, and therefore we have to balance the benefits and the risks. Trial reductions are recommended to check that the medication is still having a benefit. Opioid pain medication is not as helpful for chronic pain as it is for acute pain. Never take more than the prescribed dose in an attempt to increase the pain relief. This can lead to serious side effects. Always tell your GP or pain clinician about any other substances you're taking in addition to medication. That is the end of the 5th recording of the Pain Management Programme Handbook. Thank you very much for your time, and we'll see you in the 6th and final Pain Management Handbook recording. Goodbye.